It is story time today, folks. I've got some news about tremendous results with amazing EvexiPEL hormone replacement pellets. I'm going to tell you my personal testimony after using EvexiPEL myself. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas, and I'm going to share my own story with you today, my experience following my EvexiPEL procedure about five and a half weeks ago. Yeah, if you've tried biot before, you may be surprised by the experience. First, for those that are unfamiliar, I feel like we need to talk about what hormone pellet therapy really is, why hormone therapy is recommended for some patients, and who really benefits the most. Hormone pellet therapy, right? If you've done biot, you know what it is. Here at Creekstone Integrated Medical, we use EvexiPEL. EvexiPEL is an advanced hormone substitute method like biot that makes use of bioidentical hormone pellets to help men and women along on their adventure to overall fitness and wellness and a better enjoyment of daily living. EvexiPEL is the same product as biot, but with some key differences. The most important differences are that they are inserted in a smoother way that tends to heal faster. For male pellets, they're put in the flank, while female pellets are still in the glute and hip region. The next huge difference between biot and EvexiPEL is that the pellets are covered. EvexiPEL pellets are covered in a steroid coating, which the coating reduces inflammation, it speeds up the healing, and reduces any risk of a pellet coming back out after insertion. And after my experience, I'll tell you that it probably cuts down on any kind of discomfort or aggravation. Dr. Terry Denui founded EvexiPEL after she became disillusioned with the conventional sick care technique of Western medicine. She desired to do greater for her patients. She desired to assist them to get well, live well, and stay well. So my personal EvexiPEL experience, I have personally battled with hormone replacement therapy for about a decade now. My testosterone replacement battle really began with gels. And because honestly, who wants injections every week, right? Not me. I wasn't signing up for that immediately. So the beginning was with gels. And when I got it, I was really disheartened by the warning labels on the gel bottle. It was clear that I couldn't allow any of my small kids, and I had small kids at the time, I couldn't allow them to come into contact with the gel, either straight out of the bottle or if the gel were still wet on my shoulder. And my daughter wanted to give me a hug all the time, right? So because the contact with the gel could cause them to begin developing hormone issues and growing things that they shouldn't be growing, things of that nature. And nobody wants that for their kiddos. So besides the unpleasant dangers to our fellow small humans, the gels never really seemed to make any difference for me. I tried them. And from there, I switched to injections. And injections had to be done once per week. Now, of course, we always forgot what day it was, and we always forget to get it done. And there were supplies we always had to keep up with. My wife didn't feel comfortable giving me injections, so I had to go and see my sister-in-law, who was an LVN nurse. I had to go see her once per week, and she was kind enough to oblige. Now, besides the fact that the injections never provided any noticeable difference for me, really, I got tired of having to go somewhere once a week to get a shot that didn't seem to make any difference in the first place. It just didn't make any sense. It was a waste of time and money and energy. Now, the next step was to try hormone replacement pellets. The only brand in town at the time was biot. And I liked the idea of paying for the convenience. It's a little more expensive than the shots and the gels. But what I liked about it was the price was worth it to me because it was more convenient. Because I only had to do the procedure once every 6 months and take a daily supplement. No supplies to keep up with, nothing to have to remember every week like the injections. It was just easier. Now, having great relationships with many of our local medical professionals, I chose to have biot pellets, and it was a quick and easy procedure, and my provider did an excellent job. She's super professional and great. No complaints whatsoever. But here's the thing though, it stayed irritated for a good 7 to 10 days, which I wasn't expecting. I was thinking, 3-4 days. And I don't love pain, okay? But being a college football player, I've dealt with pain for years. I dislocated this shoulder 5 times and this one twice, and my toe, and broke bones. I'm used to pain. So it's not typically, pain is not something typically that affects me strongly one way or the other, usually. But this thing, it just stayed sore on me and aggravated long enough that I wasn't in a hurry to have it done again. However, it did make a difference in how I slept, my stress level, my energy, things like that. Absolutely. But I didn't opt to do it again for a while. Now let's fast forward to 2021 when we integrated here in our clinic with a medical director and nurse practitioner. And at that time, we brought EvexiPEL in as our chosen hormone replacement therapy. And I was noticing more recently that I was getting tired. I wasn't sleeping well. And more than anything, I was overwhelmed, stressed. I had anxiety that was just off the charts, almost like a hopeless feeling in some ways on some days. My cup was running over, if you know what I mean. And that's when I asked our nurse practitioner to run the lab work on me, and let's see what we get. And sure enough, I was way low again. It was time to give EvexiPEL a try. So we set it up for a Friday afternoon after I was done seeing patients. So when we did it, it took about 15-20 minutes, and I gotta say, I had zero pain and zero discomfort at all, which absolutely blew me away, folks. Typically, you expect the deadening to hurt, right? Because lidocaine kind of burns a little bit. Well, it can burn a lot, actually. But our nurse practitioner, our clinic, we use sodium bicarb with the lidocaine, and that takes the sting out of it. So from start to finish, I felt zero pain at all, nothing. So I was figuring I had about 3 to 4 hours before the lidocaine wore off, and then it would probably start getting sore on me. And I've got a pretty tall pickup truck, and I fully expected getting in and out of that truck it'd probably become a chore by the time the evening time rolled around. But not true at all. That was fake news. If someone were to slap me on it or kind of push on that spot, well, sure, it probably would have been sore. But otherwise, I had no pain at all. Not when I moved, not when I rolled over in bed, or not when I slept, not when I got in and out of the truck. No pain or discomfort whatsoever, which was a vastly different experience from my biot experience. I just couldn't have been happier with that part of the process. It was so easy. And then there's my symptoms. So right now, 5.5 weeks later or so, I'm sleeping much, much better. I'm getting tired at night when I'm supposed to get tired. I'm not exhausted when I get up each morning. I have more energy during the day, and I seem to be in a more agreeable mood from day to day. I think I'm much more likable than I was before. I think the absolute biggest change in the last 5 weeks since getting the EvexiPEL Hormone Pellets is that I'm not stressed out and I'm not full of anxiety all the time. Worries didn't go away. It's not like the worries went anywhere. I've still got plenty of stuff to think about and to work my way through every day, but they aren't affecting me on the level they were affecting me on. And that's been the biggest blessing. So why choose EvexiPEL instead of biot? Well, EvexiPEL is an advanced form of hormone replacement because it makes the use of the very best elements sourced from nature. Each bioidentical hormone pellet is custom compounded from products like yams and cactus leaves and designed to be structurally identical to the hormones made in our own human bodies. And this guarantees that patients enjoy all of the benefits of hormone replacement without the dangers usually related to non-bioidentical hormones. Now again, EvexiPEL is the same product as biot, but with key differences. The most important that they are inserted in a smoother way that heals faster. The male pellets are put in the flank while the females are still in the glute and hip region like biot. The next difference, again, is that the pellets are covered in this super special steroid coating. Really makes a difference when we're talking about inflammation and the speed of healing, and it reduces the risk of pellets coming back out after insertion. Now, this means the patient gets the precise dose that their body needs, and they can avoid the roller coaster ups and downs that are so commonly felt with things like injections and pills, patches, lotions, and gels. Plus, with pellets, there's no need to set a reminder to take pills, no trouble with patches that fall off, or chance of transference of the lotions or gels to our smaller little humans in our household. EvexiPEL providers like us right here at Creekstone Integrated Medical are expertly skilled and trained directly by the Avexius Health Solutions team. Each clinic and provider is handpicked to make sure EvexiPEL patients have the best results possible. So, who is eligible for EvexiPEL hormone pellets? Well, if you have the following symptoms of hormone imbalance, you are a potential candidate for hormone replacement treatment. A simple blood test here at our clinic can let you know for sure before deciding. These symptoms include sleepless nights, consistent stress, weight gain, sexual dysfunction, low libido, anxiety, depression or irritability. And females that have gone through menopause and or hysterectomy, they're typically good candidates as well. Now, if you have any of these symptoms, or you're just curious if EvexiPEL and hormone replacement might be a good fit for you, call us at 806-355-3000 and make an appointment to meet with our nurse practitioner. He can tell you all about EvexiPEL and do a simple blood test to see if you are indeed a candidate for hormone replacement. If you're watching on social media, help us out right now by sharing, subscribing, commenting, and doing all the internet things for us. We'd appreciate it. Until next week, stay smart, and we'll see you then.